Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Pondering. This audio podcast is as part of the Bostix and Blitzar and the specials. This audio podcast as part of the Conveyor Maverick, and this audio podcast as part of a ZtormLabostix production. Continuing looking at works by our Goodwin, a science student at a particular academic institution in the United Kingdom. This audio podcast will sort of delve into some aspects of the pharmacology and around the patient case, a male patient case in around with a neurological condition, a neurological condition referred to as Parkinson's. So in the works by R. Goodwin, there is some works, some referred works to an author from in around 2024 that highlighted the patients with a prior three-year diagnosis of Parkinson's, taking pharmacotherapeutics such as lexenatide for about 12 months or a year, indicate no progression of symptoms, which and where excuse me, where the treatment of lexenatide was compared to a control cohort, and where the author in around 2024 and the team had informed that it had been an important breakthrough in stunting the progression of the irreversible condition. And at the same time, due to lexenatide's short half-life, approximately being 4 hours, and a daily dose, the oral dose can be prescribed due to the reduction of excuse me, due to the reduction of gastric emptying and slowing of metabolism. But at the same time, it is where our Goodwin in their works, in our Goodwin's works, it was where there is around the pharmacological aspects, in around the patient case, and in context of pharmacology, those with reduced renal function are warned against, have been warned against using this particular pharmacotherapeutic due to its excretion through the renal system. And also, it is important. It is important, at least in where our Goodwin informs, that to note that lexenatide is or had still been part of clinical trials for the treatment of Parkinson's conditions, and so therefore the patient case in our Goodwin's works may not be prescribed lexenatide, but it may be an option in some regards, sort of prospectively. So currently, in amongst some of the literature, the pharmacotherapeutic sort of choice, the pharmacotherapeutic choice is or has been levodopa based intervention or pharmacotherapy, whilst dopamine cannot cross the blood-brain barrier, its precursor levodopa is and can be converted into dopamine by dopa decarboxylase in the central nervous system and the parasympathetic nervous system. And once released by dopaminergic neurons, levodopa is transported back into the terminals, or is metabolized by catechol methyltransferase or by monoamine oxidase. Carbidopa is usually also added to levodopa to increase its biopharmaceutics or bioavailability and sort of decrease the adverse effects. Levodopa at the same time has a sort of broad pharmacotherapeutic index, and therefore recipients are usually started on low dose with excuse me, with a low dose on the basis to increase with the basis of potentially increasing the dosage depending on individual's tolerance to the adverse effects of the pharmacotherapy. Commonly, levodopa is also administered orally. However, excuse me. However, there have been reports that continuous intestinal infusions produces fewer adverse motor fluctuations. And so it is in our Goodwin's work in around the patient case that's described. It is where is the first sort of form of treatment, levodopa being the first form of treatment that the patient would be prescribed with a regular review to assess its efficacy. So that draws this audio podcast to a close. This audio podcast is part of the Pondering. This audio podcast is part of a Bostix and Blitzar and the specials. This audio podcast as part of the Conveyor Maverick, and this audio podcast as part of a ZtormLabostix production.